Having to run out in the middle of Sherwood and Dundas completely naked because the guy hid my clothes, and I had to run out in the middle of rush hour on a Friday afternoon completely naked screaming, and there were 4 police officers on the corner and not one single person helped me. My name is Nikki. I was born in Newfoundland on July 5th, 1975, which makes me 36. And I have been on the streets for off and on for 6 years. I was brought up in a very well-to-do family with a mother and a father. I was a very lonely child. I was an only child and trying to make my mother happy at all times, and we never got along. I graduated from Cedar Break Collegiate High School, and I was in the military. I was training to be a medical paratrooper because I have my first year nursing, and I'm scared to death of planes and heights, and I thought I could conquer it. And I was working 3 different jobs at the same time because I was a single mother and trying to prove myself. And then I went to George Brown College and I graduated with hospitality management, and still can't get a job because I have nowhere to live, and I just need to get in proper housing so I can get to see my children again. But the only job offer I've gotten is at a strip joint, and I'm like, you know what, I've had children, nobody wants to see me naked. So that's the only job offer, and it's pretty sad. And the reason why I'm on the streets is the father of my second child, Jordan May, she was born 3.5 months premature with cerebral palsy, and her dad was very abusive, and so we went to a parenting transition home, and he still found us, and I was having breakdown after breakdown. So I dropped my daughter off at daycare and walked away, and that was the hardest thing I ever had to do. And I'm still trying to pick up the pieces. Like, I know she's better off because I didn't know how to play with my own child because of cerebral palsy, and nobody would help me. So I did the next best thing. I gave her the help, and I haven't seen her in 5.5 years. And when I put Jordan May into foster care, I lost all my benefits and like mother's allowance, everything like that. And I came down here, and I was staying in the shelters. And then when I started getting my shoes stolen off my feet, I started coming around this area where I ran into everybody that I hang out with now, and they've always taken care of me. Like, I'm still a fish out of water down here compared to everybody else. Everybody else that I know that's been on the streets, they've been on the streets for decades. I believe that one of the true things behind homelessness is addiction, mental stability and addiction, and just not giving a shit because nobody else gave a shit. They need to be loved. A lot of people don't believe they're any good because they've been told their entire lives that they're a piece of shit. And they're not. They just have to realize that. And it's really hard in this world when there's not many people motivating people in the right direction. Usually people are motivating people in the wrong direction. But the government doesn't listen. They don't go, a lot of them, unlike you guys are coming around and making a difference and actually listening to us and trying to making it better. The government should take cues from you guys, because it can happen to anybody. With the blink of an eye, it happened to me. And give a homeless person 5 minutes and ask them why they're sitting there instead of making a snap judgment. Just stop and say hello. And it makes a big difference. It makes a big difference in a person's life just to say hello. It makes a big difference in a person's life just to say hello. It makes a big difference in a person's life just to say hello. You know, just don't ignore them.
Hi, I'm Manjeet, and today I will be discussing the concept of poverty and homelessness. In Canada, the issue of poverty and homeless are ongoing and significant problems. Poverty is considered to contribute the most significantly to homeless and is threat to the quality of life, health and development. It's important to recognize there is not a universally accepted definition of poverty, but there are some other common definitions used by the policymakers, such as basic needs, market basket measure, low income cutoff measure, and low income measures. Each of these measures of poverty reflect insufficient financial resources to afford the basic living expenses such as food, shelter, clothing, other necessities, and other essential outside of only physical needs. If an individual cannot afford the basic needs, they are considered poor. The low income measure is based on individual income and assumes that 50% of someone's cost is on food, clothing, and shelter. The low income cutoff measure recognizes that if a household spends more than 70% of its income on food, clothing, and shelter, they would have minimal income for other costs. Family to be considered living in poverty would have to have lower income that are actually below the low income cutoff measure based on their family size. Even though the low income cutoff measure is an important measure for showing the rising rate of poverty across the country, Statistics Canada does not consider this as a measure of poverty, even though some policymakers consider this to be one, and the same with poverty. We must also acknowledge that someone can be considered working poor if their family income is below the cutoffs. This may be the result of high income taxes to lower income employees, consumption taxes, and slow increase of wages. As the same for the poverty, homelessness has many definitions. Just to name a few, it may be episodic, where someone may move often or has no periods of housing. It may be situational or seasonal. Inadequate, which lack basic facilities. Rooflessness, meaning living on the streets. Houseless, where one may use shelters or to be in the institutions. Those who are at risk, meaning their housing or economic situation is precarious, or chronic homelessness, where it's long term. The Canadian definition of homelessness addressed on the Homeless Hub is the situation of an individual, family, or community without stable, safe, permanent, appropriate housing or the immediate prospect, means, and ability of acquiring it. It's important to acknowledge this definition does not take into consideration the various phases of homelessness that an individual may be experiencing and not only an issue of housing. This definition was further expanded in a research report, The State of Homelessness in Canada 2013, to acknowledge the impact of other factors on homelessness, such as systemic and societal barriers, lack of housing, affordability, individual and household challenges, and racism or discrimination. It's evident that other aspects that are lacking in one's life, such as unity, rootedness, social connections, family relations, and not just a home, that contribute to homelessness. Homelessness is thought to be a choice by some. There is this misconception that individuals who are experiencing homelessness are lazy and are able to effortlessly change their circumstances. In fact, this is not true and is very complex. In many reasons, people experience homelessness that are not within their control, such as lack of affordable housing, eviction, coping with mental and addictions, and lack of structural support when experiencing job loss, poverty, and inadequate discharge planning for people leaving healthcare facilities such as the hospitals and mental health institutions and the correctional facilities. We must recognize that there are various factors and pathways that lead to homelessness, and various subpopulations are affected more greatly than others. Therefore, the face of homelessness exists everywhere in Canada, and we must careful we do not shape our notions of who we think is a homeless person when in fact there is no typical person who fits those ideas. This is because not only does living on the street mean someone is homeless, but also those who are living in the precarious situations and are impacted by the multiple of cumulative circumstances rather than a single cause. Thanks. Over to my group mate.
When you picture a homeless person, do you see a woman? Everyone, I'm Jennifer and I will be discussing the current state of homelessness and housing affordability in Canada. According to the 2016 State of Homelessness in Canada, at least 235,000 Canadians experience homelessness in a given year. Women make up the 27.3% of the overall homeless population. It is estimated that a minimum of 35,000 Canadians experience homelessness on any given night. In 2009, there are approximately 14,400 Canadians staying in emergency homeless shelters. There are a total of 15,467 permanent shelter beds, but in 2014, 92.4% of those beds were filled. The National Shelter Study from 2005 to 2009 found that 26.7% of all shelter users were female. But this percentage does not include the 6,350 Canadians staying in violence against women shelters, which accounts for one-fourth of homeless Canadians. In addition, the estimates does not include the hidden homeless. Homelessness in Canada is often hidden. A woman may be temporarily staying with friends or family. According to the Canadian Observatory on Homelessness, there may be as many as 50,000 hidden homeless. Why is there so many homeless women? There are many factors of why many women are homeless. One of those factors is the lack of affordable housing. Often, a woman has very few choices when looking to access safe, appropriate, and affordable housing. Currently, Ontario has a housing crisis. Home prices and rents in Ontario's many large and mid-sized cities have risen faster than incomes. Rental prices are up to 10 to 15%. 56% of renters cannot afford average two-bedroom apartment, and less than 2% of rentals are vacant, while incomes are only up 2% per year. Does any of these statistics surprise you?
Hello everybody, this is Yang. Today I'm going to talk about the health determinants of homeless women. According to Nettle and Wells, health determinants are those factors that can influence health. Also in their chapters, the term of social determinants of health means different socio-economic groups come to experience different level of health and illness. Homelessness among women is an increased social and health issue in Canada. According to Gates, women are at increased risk for hidden homelessness, living in overcrowded conditions, or having insufficient money to afford a shelter. Through literacy review, homeless women share a number of similar features that may contribute to their overall poor health status. These include in low income and social status, unsafe physical environment, lack of education and literacy skills, limited social support, social exclusion, and unemployment and poor housing.
Social exclusion has been recognized as a key determinant of health. Social exclusion refers to the inability of certain groups or individuals to participate fully in Canadian life due to structural inequities in access to social, economic, political, and cultural resources. These inequities arise out of oppression related to race, class, gender, disability, sexual orientation, immigrant status, and religion. Social exclusion places certain groups in disadvantaged positions in society, which ultimately impacts their health and well being. In Canada, Aboriginal Canadians, Canadians of color, recent immigrants, and women are especially likely to experience social exclusion. Socially excluded Canadians are more likely to be unemployed and earn lower wages. They have less access to health and social services and means of furthering their education. In women, intimate partner violence, extreme poverty, and mental health problems. In addition, the inaccessibility of affordable childcare are factors that shape homeless mothers' health experiences and places them in socially excluded position. As a result of homelessness, mothers are excluded from the full economic, social, political, and health benefits of society. A study by Stewart et al. In 2008 on the relational process that lead to social exclusion or inclusion found significant relationship between health and social exclusion. They indicated that limited financial resources, poor health, and societal scrutiny inhibited lower income participants from becoming involved in the community. As I mentioned, Canadian women are socially excluded. As a socially excluded group, women are denied full access to legitimate means of acquiring economic resources. Economic exclusion is evident in the persistent wage gap between male and female workers. In Canada, the ratio of female weekly wages to male weekly wages has increased over the past decade and half yet remains at 0.77 as of September 2016, demonstrating persistent gender wage gap. Women are also more likely to have precarious work and experience unusually high unemployment rates. Precarious employment is work that is insecure, offers limited protections and benefits, and allows worker minimal autonomy, recourse, or control. Women represent 75% of part-time permanent workers and 62% of part-time temporary workers. Precarious employment is shown to shape and limit important decisions, including partnership formation, where to live, housing, when to start a family, childcare options, recreation, and many other choices that can impact the quality of life and well-being of individuals and households. It has ill effects on the well-being of individual workers. Employment provides income, a sense of identity, and helps to structure day-to-day life. Unemployment, on the other hand, leads to material and social deprivation by reducing income and removing benefits that were previously provided by one's employment. Unemployment also leads to psychological stress because losing a job is stressful and lowers one's self-esteem, disrupts daily routines, and increasing anxiety. Unemployment also increases the likelihood of turning to unhealthy coping behaviors such as smoking and drinking. Lack of employment is associated with physical and mental health problems that include depression, anxiety, and increased suicide rate.
Income greatest influence on people's health status and behaviors, and the use of healthcare services, regardless of age, gender, culture. Lower income Canadians have poorer health, with more chronic illness and early deaths than those of higher income Canadians. The fact is, new Canadian mothers living on low income were 20 times more likely to have multiple health problems than those living on high incomes. According to the report from Employment and Social Development Canada in 2011, low-income rates are more prevalent among certain subgroups of women. First is Indigenous women and visible minority women, because they are more likely to have lower income than the non-visible minority women in Canada. Also, compared to two-parent family, single mothers are more likely to have lower income, and they are 5 times more to have lower income below the low-income cutoff line. Even though some provincial governments have put programs in place to assist the low-income families with early kindergarten programs, subsidized housing, and child benefit. However, To the homeless woman, the challenge is without a fixed address, may still have difficulty access these programs. Also, according to the Statistics Canada report in 2015, women are more likely to be in the position of lower employment categories. Lone parent families continue to experience the lowest level of family income in Canada, with majority of these are by women. From the chart we noted, from 2008 to 2014, the group of tend to remain in the poverty. Another analysis report from Statistics Canada in 2015, women earned only 87 cents for every dollar earned by men. And according to the metric, women aged 25 to 54 earned an average of $52,000 in 2014, while the males earned around 70,000 in the same position. From here we can see the wage difference in gender made women even more difficult to afford a house. Second, unsafe physical environment, which is the major cause of homelessness for women, is domestic violence. It is a significant reason why they end up using homeless shelter. Family violence estimated to affect 2 million Canadians. The domestic violence can force the woman and children to leave home suddenly without the proper support in place. The fact is, including not only emergency shelter, but also transitional and second stage housing, count on April 15, 2010, 7,362 beds were occupied by women and their children in Canada. In addition, another concern is when women become homeless, they are at increased risk of violence and assault, sexual exploitation, and abuse. Homelessness women may be pregnant, and there are some health issues for this group of women, include access to birth control, prenatal care, breast and cervical cancer screening, and sexual transmitted infection. In addition, the admission to a shelter is another challenge to homeless women, as they may be turned away by the shelter. The most common reason is full capacity. The fact is, on April 15, 2010, in total 426 women were turned away from facility that day. And there are other reasons to turn away women, such as mental health problem, and 8% for drug and alcohol use. Third, lack of education and literacy skills are another fact. Income and education are most important determinants of health. A higher level of education linked to better health through a variety of factors, such as higher income, better health literacy, good jobs. Persons with undiagnosed or untreated literacy learning disability are more likely to drop out from school and decreasing the opportunity availability. There are upgrading classes are subsidized and with affordable transportation, but they still may not be able to afford the textbook or the child care record in order to attend class. For example, the monthly child care fee for infant in Toronto is $1,736. Many low-income families are working poor with low education. They are in and out of poverty depending on the job and housing availability and whether they have health issues. The last reason is limited social support. There are many factors that play into the role of homelessness, including the factors of loss of social connections. Loss of connection with others in turn makes the victim more vulnerable to maintain homeless, as support is lost with those social connection. Some example of the ways that the social connection are lost or have been lost are listed below. The first one is poor relationship with families and relatives. Those who are homeless often rely on factors such as care facilities, shelters, and their own skin in order to survive. In many cases, it's disagreement with family members, family abuse, strained relationship, or neglect that cause people to leave their homes, and in turn severed their ties with the families. With no house or family to go back to, many of homeless have to make a new life or living for themselves with their own skills and cannot rely on previous relatives, families, or relationships for help. This in turn make the lives of those who have left home difficult as general service for the homeless is limited. For example, as we know the definition for homelessness, it doesn't solely for the street people. It also included in the refugees, immigrant, as they leave their family tie and they came to Canada, and they have limited family support. Second, they don't have a fixed address, make it difficult to keep in touch with family and friends. As we already mentioned, it also make them hard to access to the government benefit. Third, they may not have money to travel or talk to continue the relationship. For example, they may be so far from home or friends, and they can't afford to travel back to home or find a friend.
I've moved around in and out of refuges, in and around accommodation, and yeah, it's just been a rough ride. And even now, I still consider myself as being homeless. It's homeless doesn't always mean sleeping on the streets and things like that. It can mean even in your own home if you don't feel safe and things and comfortable. So yeah, so I actually, if anything, I still consider myself as being homeless. Being a young woman on the streets is quite dangerous. I guess you do have to protect yourself. But back in my days, it was sort of on the streets, everyone looked after each other. So yes, it was hard, but you also did have the self-protection and things. But yeah, and I guess you was probably just given a bit more of an extra harder time from the police or whoever, just because you're a woman. I got a lot of fines during my time being on the streets due to either not having a ticket on the public transport, on the trains, which is probably quite a common occurrence. And then there was also the fines with beg alms when I was begging on the streets to support my drug habit. Yeah, and I guess they used to try and make an example of you, especially if they knew you were on the streets or homeless, and if you had a bit of a reputation, they'd sort of, make a sort of bit of a scene in front of people. And just, yeah, and most of the times you just sort of grab the fine off the police officer or whatever and just shove it in your pocket because, you're on the streets, you're a drug addict, you can't afford to pay the fines. So, you know, it's just waste a piece of paper as, you know, as far as I'm concerned now and back then as well. The effect of fines on my life, I guess, sort of, at the time it wasn't sort of really much of an effect, but now it's, you know, sort of they built up and you sort of get quite a shock to sort of see how much they really add up to. Even with my lifestyle at the moment and trying to budget, the fine system is just ridiculous. I mean, how someone who's on the pension expected to pay $250, you know, for not having a ticket. I've got, you know, my dreams, my futures for the rest of my life. I've got two, you know, beautiful boys that they're hard work and they mean the world to me. And yeah, just my other dreams and goals is I want to do my graphic design work.
Hi there, it's Krista. I'm just going to take some time today to discuss the health and health system disparities experienced by women who are experiencing homelessness. I just want to quickly characterize the meaning of a vulnerable population and the concept of health disparity. It's important to point out that vulnerable populations are really groups of people who may, experience a greater burden of health and illness. As mentioned by the World Health Organization, health and illness do follow a social gradient, and therefore the lower the socioeconomic status, the not so good is one's health. This is further complicated and presents, more challenges if someone is actually, female gender and with precarious or without housing. So essentially, gender and someone's income, which is interrelated with poverty and homelessness, can determine who is vulnerable. Being not only homeless but also a woman, the individual falls within this vulnerable subpopulation and, really places the individual at higher risk to experience more ill health and are actually less likely going to, access ongoing health care. When we think of the concept of health disparity, we're actually talking about differences in health status among groups and populations, which includes differences in healthcare services that an individual may access or are available to them. So there was actually a report from, McGill University that discussed the available research on homeless women in Canada. The report, mentioned most of the homeless individuals in Canada are men, and therefore that most services are tailored, to their needs, despite knowing that women are actually more vulnerable. So, many of the social determinants of health directly impact the health status of homeless women, contribute to significant differences in their health as compared to men. McConan and Raphael in their document, The Canadian Facts, they do mention the difference in life expectancy between men and women. And women typically live till 79 years of age, whereas men live till around about 76 years of age. So what's important, though, is that this difference does not imply that women have better health, but actually, in fact, that women experience more, chronic diseases and more occurrences of long-term disability. So it's, important to state that in general, those who are homeless, middle-aged specifically, it's common to see that they have disabilities that are commonly seen in people who are much older. So women are among one of the most vulnerable subpopulations with the greatest health and healthcare disparities, really compared to the general population. they are more at risk of poorer health, and their disparities actually include, higher rates of mental illness, chronic diseases like bronchitis, high blood pressure, anemia, asthma, ulcers, victimization, survival, sex work, STIs, malnutrition, substance use disorders, inadequate prenatal care, poor birth outcomes, and premature mortality. So, there's also a burden of, blood-borne infections and a noticeable increase in the rates of smoking. And obviously, consequently, higher rates of cardiovascular disease, respiratory disorders, and cancer. So the data from McGill also indicated that 74% of Canadian women actually sought shelter services because they were being abused. So this narrative of women and their experience with violence and abuse is really also rooted in, sexual, physical, and emotional child abuse, really, which results in low self-esteem, this inability to maintain healthy relationships or continue to seek abusive relationships, as well as depression, anxiety, and substance use disorders. So homeless women recount that, one of the main reasons for becoming homeless is because they're involved with abusive partners, and the lack of, more safer housing alternatives really leads them to repeatedly returning to these toxic, abusive relationships. So considering the high occurrence of violent experiences and trauma among homeless women, it's not surprising to really see, mental health problems are more prevalent, especially, with a mix of this, stressful environment and the lack of social support that often discourages really this means to heal for them. The American College of Obstetricians and Gynecologists have also stated that for chronically homeless women, it's estimated that 30% of them are living with, mental illness, and 50% with substance use issues. So, in Canada, this has really been found to be, 1 in 4 with mental health and 1 in 5 who are experiencing drug and alcohol problems. It's also been noted that there's, it's common for repeated hospitalizations for mental health over a lifetime as well for these women. So really recognizing this high prevalence of, mental health problems and substance use disorders in women is essential, as, this can result in more episodes and longer durations of homelessness among this group. So these complex relationships are critical to acknowledge, as, unaffordable housing and homelessness are linked to higher rates of disease and mortality, lack of personal safety, and really barriers to accessing, healthcare. So among the homeless, in general, it's commonly mentioned that they often have unmet, healthcare needs, and that those most vulnerable experience barriers to service. So, for example, those with mental health diagnosis or multiple chronic conditions. And these challenges have been echoed in many studies among homeless women. So, pertaining to healthcare services, they're less likely to access primary health care or have health insurance, which is really critical for, getting medications and other services and treatments. And really, having to worry about where they're going to sleep that night or where to access their next meal is really a significant source of mental distress, and it often competes with meeting their healthcare needs. Poor living conditions also contribute to nearly every health condition and disease. That's as a result of, environmental exposures. It may be temperature related, lack of sleep, or no money for hygiene products like, menstrual supplies, soap, deodorant, things like that. Reproductive health is greatly impacted by, the higher rate of unintended pregnancies, lack of access to emotional and practical supports during pregnancy, and really feeling judged by shelter staff as they may be pregnant and living on the streets. There was some other findings in another study in the U.S. that emphasized that health and healthcare disparities, touch upon homeless women of all racial and ethnic groups. And really that all these women are at risk for disease, poor health outcomes, and experience, this lack of access to appropriate medical services and care. But what's really important to mention is that there are significant differences in homelessness experienced by racial and ethnic groups. For example, white women are more likely to, experience mental health and substance use, whereas women of color may be more likely to be homeless due to housing unaffordability. So the McGill report does mention that over 1/3 of women in Canada are also impacted by this based on their racial ethnicity. The last point I wanted to further explore briefly is related to healthcare delivery, discrimination and the experience of the community. So, street-involved women have mentioned that they avoid accessing and delaying seeking healthcare due to negative interactions with their healthcare providers. So this is really a substantial barrier to engagement of women in care. So, so the delivery is highly fragmented. It's influenced by, other variables as well. So the practices of healthcare providers further marginalize, the health of homeless women and exacerbate their health disparities, more specifically those living with substance use disorders. So it's really not uncommon to hear women disclosing that they're feeling, stigmatized as drug seekers. And really, this is very concerning because it puts them at risk of high-risk behaviors such as unsafe drug use, or, at risk of, Hep C or HIV infections. They're more vulnerable to violence. And again, it really just limits those opportunities for engaging in care. So, in general, for the homeless population, though, regardless of gender, the attitudes and behaviors of healthcare providers can greatly impact whether people feel safe to seek care. And unfortunately, this can lead to, underdiagnosis, mistreatment, non-adherence, or discontinuation of treatment, and unfortunately, poor mental and physical health. So, when I really think of my own nursing practice, working in the community health center, I often consider how my interactions are, impacting those whom I provide care for. So for me, I recognize how critical it is for vulnerable groups such as homeless women are to be given every possible opportunity to access equitable services where they can manage their health issues and prevent deterioration of their health. So what I would really like to leave you all with is to really ponder and to consider your own personal attitudes and behaviors in your practice, or even the places that you work, which may be further, perpetuating these health disparities that homeless women experience. And then to really consider, how you can change your practice or the places that you work, so that where you're offering services or care to women, that you're ensuring that you're establishing these, meaningful and trusting connections with people. So this may facilitate access to healthcare. Okay, thank you.
Jennifer, and I'm a community health nurse, and I am going to take a few minutes to talk about the barriers associated with accessing healthcare for the vulnerable homeless population. And I am also going to be addressing the implications for community health nursing. So how in a country like Canada, with a universal healthcare system, could anyone have unmet health needs? What is known is that even with nations where universal healthcare exists, health needs of this vulnerable population are not adequately met. Then what are the barriers? The main barriers to good health include a lack of adequate, safe, accessible, and affordable housing, which in turn is linked to employability, community support, personal health care, and access to health services. Stamler and Gabriel, in their chapter on poverty and homelessness in the Stamler and U213 text, categorize the barriers as external and internal barriers. External barriers are systemic or structural in nature. Proof of eligibility criteria in the form of an Ontario health card, which requires identification and a permanent address, is an example of a structural barrier. Loss or theft of belongings, including identification, is common among those experiencing homelessness, and even those who have a health card still experience limitations. For example, supplies to manage chronic health conditions such as diabetes and other health-related supplies such as sanitary pads are not covered, and this impacts not only a woman's dignity but also the increased risk of infection and even further complications of chronic health conditions. Lack of family doctor or a nurse practitioner is another common barrier among the homeless population. In a Toronto study by Erica Kander and colleagues in 2011, they found that fewer than half of homeless participants had a family doctor. Of the 366 participants that they surveyed in the study, 97 were women, and of the 97, 52 did not have a family doctor. They suggest that this is associated with other factors that impact access to healthcare and health status, such as increased duration of homelessness, lack of proof of health insurance coverage, and having a chronic medical condition. Other external behaviors include, barriers include lack of resources regarding where to obtain care, non-central location of health clinics, clinic registration requirements such as a need for identification, a permanent address, and a telephone number, and lack of transportation options to attend appointments, inadequate or inaccessible childcare are often barriers for those experiencing homelessness, and in particular women. As a result, persons who are homeless may be unable to make and keep follow-up appointments and or receive coordinated care, since their comprehensive medical needs are not kept in one location with one provider. This leads to fragmented healthcare delivery that's concentrated in emergency departments, often the core of urban centers or in shelters or other facilities that support the homeless person. Similarly, Cheryl Zlotnick and colleagues in 2013 found that lack of permanent housing complicates the basic self-care and treatment adherence. So shelter system rules such as daytime stay limitations mean that individuals who are ill or recovering from surgery, they do not have a safe place to rest and recover, and they're also less likely to have someone who can take on that caregiving role to support them through their illness. In addition, medication adherence is impacted since being out all day makes it difficult to keep medications organized and refrigerated if that is required. Stigma and discrimination are significant barriers that impact a large proportion of homeless in accessing healthcare. Kander found that an unwelcome attitude was most often encountered by individuals who were homeless, and the next most common was by those who use substance. This is an important finding given many who are homeless also use substance, and therefore they have greater health needs, but they're less likely to access healthcare, and when they do, they may encounter barriers specific to their substance use, such as perceived drug-seeking behavior. An unwelcome healthcare system is likely to have a negative effect on an individual's desire to seek healthcare in the future, even when other barriers have been reduced. In addition, the longer duration of homelessness, the greater experience of discrimination, the more significant stigmatization is as a barrier. Therefore, further efforts are required not only to improve the availability of appropriate primary care services, but also to ensure that these services are welcoming and non-discriminatory. So Stamler and Gabriel 2013 also identified low levels of literacy and education as barriers to healthcare, as well as lack of economic independence and reduced access to computers, internet, and computer training, which is of more significant concern for middle and older adults who may have not developed these skills when they were younger. This is concerning since technology plays a significant role in homeless persons staying connected with families, resources, and accessing healthcare. Internal barriers include individual perceptions of health and competing priorities. The need to seek shelter, food, and employment often interfere with regular administration of medication and attending follow-up visits with healthcare providers. Fear of being judged and mistrust of the healthcare system born out of the experience of discrimination and stigmatization are internal barriers to accessing healthcare. Salem and Mafam 215 also found that middle and older African American women experience fear of testing as a barrier to accessing PAP and HIV testing. So what is the role of the community health nurse in addressing the barriers? According to Spears and Colleagues 213, nurses have a role to play in promoting health screening and providing support and advocating for homeless by monitoring health needs, reducing financial burdens, and assisting with access to social services. This involves understanding the social determinants of health, such as poverty, gender, and social exclusion. Stamler and Gabriel and Stamler and U213 cite community health nurses' scope as health protection, promotion, prevention as critical to addressing the internal and external barriers and improving health in this population. Political action and community empowerment utilizing critical social theory guides community health nurses to examine and reflect on existing social structures that support oppression. In practice, community health nurses recognize oppressed groups such as homeless women as the experts of their lives and join with them as consultants and facilitators to identify the root cause of their oppression, build knowledge, and improve resources. An early pioneer in this area of nursing is Kathy Crow, who started her career as a street nurse, used political activism and legal action to increase affordable housing in Toronto. Other programs such as the Homeless at Risk prenatal program delivered by the PHNs in the City of Toronto engage women living in shelters or on the street to have healthier pregnancies and infants. These nurses meet the women where they are at, accompany them to medical appointments, provide transit tokens, prenatal vitamins, and assist the women to find secure housing. The CHN role includes advocacy for programs that reduce inequity and improve dignity and health through liberating initiatives, such as the current campaign for the City of Toronto to provide free access to tampons and sanitary pads for women who are marginalized.
Thanks so much for signing up to this. In case you're wondering, I'm Kathy Crow. So I'm actually a street nurse. You heard that term before? Yeah? I'm a street nurse, so it means that all my work has been in the area of homelessness for about 30 years. So gentrification is a big word. It's usually it applies to people or businesses or corporations that come into a territory, come into an area, community, buy up property and space for redevelopment, primarily for financial benefit. And what's in common with forms of gentrification is it pushes the original community out. So we've seen that in many places in Toronto over the years. So this is a really historic corner. So in 1986, a woman named Drina Joubert froze to death on the back of a pickup truck. She was a South African model who became mentally ill and homeless. And when she was found dead by my colleague, police said, keep this quiet, don't do anything about this. And he said, I think not. And there's an article on Vice about that today. They had an inquest into her death, and it led to something called Project 3000, which is 3,000 new units of affordable housing that the province of Ontario paid for. And that's one of them right there, that 6 or 7 floor building. It's called Cornerstone. So when people say, oh, it's complicated to solve this problem, it's not, right? There you go, right there. And people live there that have lived there since it opened. The yellow brick buildings over there are co-ops. And I point that out because up until 1993, many of you will know we had a national housing program. We built 20,000 new units of affordable housing a year across the country. So that's an example right there. Because people say, whoa, this homelessness problem is so bad. Well, that's part of the reason, because it got cut by the Conservative and Liberal federal party. In a way, what's happening right now is like a living experiment, and I'm afraid that while we're seeing some positive aspects, some in Regent Park with the redevelopment, some social assets coming to the community, large other areas of gentrification happening are very detrimental to the city and to city planning and to city growth and city health.
We have discussed the social determinants of health and barriers to care that underlie health disparities and unmet health needs experienced by women who are homeless. We have also outlined how this knowledge is applicable to nursing practice regardless of the setting. At this time, we ask that you reflect on what changes you might make in your individual practice or advocate for within your practice area that may reveal or address barriers to care for this vulnerable population. Reflect upon how these actions, big or small, may reduce inequities, promote dignity, and empower women.